Our patient today is a 42-year-old mother of three who, as you can see, has got quite a protuberant abdomen. And you can see all of this extra skin that's overhanging even her pubic area. Now, some people may look at her and say, well, geez, isn't she just overweight? Shouldn't she lose weight? But actually, when you examine her, a lot of what you're seeing here is looseness from having two children. And you can't quite tell unless you actually examine them and feel their tummy. So we are going to progress to go ahead and do a tummy tuck on her. The plan will be to remove as much of the skin as possible to get her a much nicer result. Okay, here are her markings. I'm going to make an incision basically from hip to hip. The goal is to remove as much of the skin down here as possible. I'm also going to do a little bit of lipo out here, and I'll show you how she looks when we're all done. Okay, here are our final results. She has done great, and you can see there is a hip-to-hip scar. I was able to remove almost all of that skin that we had planned to remove from her, so I'm really happy about that. Also tightened up her muscles on the inside, so I think she's going to be a really happy person. Here's all the skin that we've taken off. As you can see, this is a lot of skin that we've removed from her, and it's going to be a huge change for her. We are now 7 weeks after her tummy tuck, and she is looking fabulous. You can see just how flat her tummy is. She does have a scar, and the scar is hidden underneath her underwear from hip to hip, a little scar around her belly button, and she's using her scar creams diligently to keep things looking nice and flat, that scar. So she still has a ways to go. There's still some swelling. She's actually going to flatten out with time, but we are doing really, really well for being 7 weeks out. As you can see, she had a massive change from this operation, but it's only going to get better as time goes on. And those scars that she has, the hip-to-hip scars that are hidden underneath her underwear, that scar around her belly button, those are permanent. Now, because she has darker skin, she has at a higher risk of a darker and a thicker scar than a patient with lighter skin. And for that reason, we've got her intensely using scar creams, and we're going to continue to follow those scars and follow her swelling as it comes down over the next few months. And I think she's going to get an even better result than what you're seeing here. Well, if you've enjoyed this video, take a peek at this other tummy tuck video and other playlists down here if you want to watch more plastic surgery.